All right, let's talk about the coxal bone. Um, this is the coxal bone. This would be the medial surface right here, or medial side. This would be lateral, where the socket is, or the acetabulum. This would be the front. Here's the pubis. You all know where the pubic region is. It's in the front. So this would be the front. This would be posterior. I can't zoom this out anymore, but this would be the posterior side here. Anterior. Superior. You do have three bones. You have the ilium, the pubic bone, the ilium, and the ischium, the ischial bone, iliac bone, and the pubic bone. During childhood, they are three separate bones, but as an adult, they fuse together, forming one coxal bone. So we'll refer to those regions as the ischium, the pubis, and the ilium. All right, let's talk about the structures on the ilium. We have the iliac crest, which is on the superior side. It's an attachment site for muscles. You've got the iliac fossa, which is a shallow depression. You've got the greater sciatic notch, which is this region right here. That's where the sciatic nerve passes to enter the thigh. You've got the auricular surface, which is this region right here, and that's going to articulate with the auricular surface of the sacrum. So that should help you orient this correctly. You want to make sure that's oriented medially. Your acetabulum, which is the socket, it's going to articulate with the head of the femur. Put that lateral. Put the pubis in the front. That's anterior. This would be a left. This would be a left. It's the lateral side. We'll receive the head of the femur. The medial side, you can see the auricular surface will articulate with the sacrum. Pubis in the front. This is a left coxal bone. You've got the anterior and posterior iliac spines. Now that you figured out this would be the posterior region, this is anterior. You have anterior superior, you have anterior inferior iliac spines. You've got the posterior superior and posterior inferior iliac spines. So they're just named using your directional terms. Top front, bottom front. Top rear, bottom rear. Posterior superior, posterior inferior. Anterior superior, anterior inferior iliac spines. And they're going to be attachment sites for muscles of the trunk, hip, thigh. Oftentimes that anterior superior iliac spine will be used as an anterior landmark. I'm sorry, as a landmark, anatomical landmark. So the anterior iliac spine is used as an anatomical landmark. You've got the ischium, which is this lower back portion. You have your ischial spine, which is an attachment site for the sacrospinous ligament. You've got your ischiotuberosity, pretty prominent. That roughened region right there. That's an attachment site for the hamstring muscles. You've got the lesser sciatic notch. Here's the greater. Here's the lesser. That's a passageway for nerves, blood vessels that serve the anogenital region. Then you got the pubis lower front portion. You've got the pubic symphysis, which is formed when this articulates with another coxal bone, which would be this region here, and you'd have a pad of fibrocartilage in between there. Then you've got the pubic crest right here. This would be the pubic tubercle, but this would be the crest. Page 2 of your textbook actually has some good illustrations on how to differentiate between a male and female pelvis, you should look that over. One of the things you want to look at, the obturator foramen are slightly different. Also, the pubic arch, where the two coxal bones come together, you have a more acute angle in a male, whereas in a female, it's less acute. Trying to think, the coccyx bone. When you look at the sacrum, when you look at a pelvis on a female, the coccyx bone doesn't curve under as much on a male. And one of the reasons for that is, women have babies, and if it was curved under more in a male, that can cause problems during pregnancy. This would probably be a male. You can see how that's curved under quite a bit. On a female, it'd be more oriented toward the back like that. But do look that over on page 209. Like I said, there's some good hints on how to tell or differentiate between a male and a female pelvis. Coxal bone, and that is a left.